morning, guys. This is Dr. Hatley, just doing a video for our week 3 wrap-up on conceptual models and grand theories that revolve around integrative and interactive nursing paradigm. So the main points of this previous week's work were really to look at viewing persons as integrated wholes or systems interacting in a larger environment. These persons are influenced by their environment, impacting the health or well-being both positively and negatively. The uniqueness of each person and the multifactorial nature of human interactions must be considered in regards to outcomes. And so when we're talking about persons this past week, that's really defined as individuals, families, groups, and or communities. And so it's a much larger environment than just the patient or the client that we're caring for. So the main theories or conceptual models that we went through this past week, the first one was Imogene King theory of goal attainment, and really surrounding that goal, the underpinnings of that would be the goal was to help maintain or regain health for the patient client, which can be accomplished through mutually agreed goals. And so defining the goal, agreeing upon the goals with the client, and then working towards those goals. Ashley mentioned this week her example was around a patient in the ICU. They had been diagnosed with an MI, and engaging that patient in those daily goal settings. So if you didn't catch Ashley's discussion, I recommend you go back and take a look at that. She did a great job explaining that for us. The second model that we looked at was Callista Roy's adaptation model. And that really was the underpinnings around that is the person's viewed as a holistic adaptive system with coping processes to remain adaptive to the environment and to promote a person-environment transformation or improvement. Could potentially be a decline as well in health and well-being. And so when we're talking about adaptive environment and adaptive systems, remember, we're all working in either acute care or outpatient settings. We're living in this world, which is really a complex adaptive system in nature, which means one thing impacts another and that impacts something else. And so it's just really saying we are living in an environment or a system in which can really have domino effects. Things impact other things. And so when we're looking at Roy's adaptive model, we have to remember that nursing is to promote coping and adaptation with health and illness to avoid compromising or compensating negatively. And so there was some good discussion around that this week as well. And then the third model that we looked at was Betty Newman's, the Newman system model. And the basic structure around that is client-client systems. And so we are all protected by various systems. And so nursing is to keep the client stable in assessing the effects of stressors or potential stressors that will come into play during that treatment process. And so our role as nurses are to assist the clients with adjustments for optimal wellness and eliminate those stressors. So an example someone gave this week was talking about patient family rounds in the ICU. And if you've had any family members in the hospital that were critically ill, I'll tell you, there's a lot of stressors that go on, and either family assist or they hinder the healing process with those ICU patients. And so I think that's a good example of how Newman systems model can be used, engaging the patient, the family, and the ICU to minimize those stressors and promote an optimal healing environment. And so one thing I want to mention is let's not confuse Betty Newman's system model with Margaret Newman. And so Betty is a Newman with a U and Margaret is a Newman with a W. We'll go over Margaret's theory of health and expanding consciousness in the weeks to come, but just wanted to point out there's two Newmans. They're spelled different, and they're two different theories. And so that's just a wrap up for this week. Here's references. I did go ahead and put references on here just so I can point out to you guys. If you're referencing a book, please, please, please remember only the first word of the book title needs to be capitalized. If there's a colon here, then the next segment of the sentence, that first word can be capitalized, but really it shouldn't be capitalized unless it's a person's name or a place. But for the most part, it's always just the first word capitalized, and then italicize the book title as well. Good stuff out there on the APA Purdue site, so check those things out, and I'll see you guys in week 4.